All right, so thank you, Davis. And just to introduce our four lovely panelists today. So we first up, we have Dr. Jennifer Adelman. She's a PGY1 resident physician at Sutter Roseville Transitional Year with plans to complete her advanced training in physiatry with the Stanford PM&R residency program. She is also a certified strength and conditioning specialist and spent over 5 years during high school and college working for a sports physical therapy company, coaching patients through corrective exercises and working with professional athletes. Dr. Adelman serves on the medical team for USA Track and Field, USA Weightlifting, and UCSF Sports Medicine. She is also an instructor for ultrasound and has taught over 100 hours of ultrasound education locally and nationally. Outside of her professional work, she enjoys kettlebell resistance training, rock climbing, hiking and camping at national parks, fishing, watching sports, and training her two dogs. Dr. Nicholas Averill is a PGY2 at Temple Physical Medicine and Rehabilitation. Nicholas has previously served in AOCPMR's Student Council as part of the Research Committee and AOCPMR's Residency Council as part of the Newsletter Committee. He is passionate about education, research, and professional mentorship. Dr. Brandon Goodwin is from Toms River, New Jersey, received his 3 undergraduate and honors degree from Keene University, went to Rowan SOM for medical school where he was a member of SSP and started numerous research groups. Currently the CEO and founder of Future Forwards Research Institute, which is a public charity nonprofit dedicated to teaching and conducting biomedical research. Brandon attended Ocean University Medical Center for transitional year, where he served as a chief resident as an intern, which is super rare, and was resident of the year. Brandon currently holds 88 publications under his name and is working on a number of publications and clinical trials at Johns Hopkins, where he is a PGY2. Dr. Melanie White is a pediatric rehabilitation medicine fellow at Mayo Clinic. She has lived across the United States and completed her undergraduate degree at Marist College, where she played softball. She attended medical school at Rocky Vista University College of Osteopathic Medicine in Colorado with an additional year to learn, teach, and practice osteopathic manipulative medicine. She completed her PM&R residency at Mayo Clinic Rochester and has a special clinical interest in spina bifida and spinal cord dysfunction and injury. She enjoys collaborating with learners and being involved in education. In her free time, Mel enjoys yoga, weightlifting, spending time outdoors, and baking. And so these are our four lovely panelists today. And so to get started, the first question that we have is for the panelists to talk a little bit about what inspired you to pursue PM&R and how you were able to develop that interest over time. And so to get started, maybe Dr. Waite, would you want to go first?
Sure. Thanks for having us, and thank you all for being here. So in med school, I thought I wanted to be a pediatrician, and then I found out about PM&R and fell in love with it because a lot of it coincides with what we learn in osteopathy, structure and function, and just really focusing on the health of the person and being able to do all the things that they want to do in their environment, no matter what. And then I found out about peds rehab, and I was like, done deal. So I love it because we get to see people from really acute injuries and hospital consults after a spinal cord injury, TBI, amputation, etc. And especially in peds, we get to see kids throughout the continuum of care until they at least graduate high school. And you get to work with individuals and their families, and there's a really strong foundation for musculoskeletal rehab, for neuromuscular rehab. And so it's just a really broad field, and I just really love the foundations of it, and it is who I wanted to be as a physician and human, and so here we are.
Dr. Averill, would you want to jump in?
Yeah. Hi. So this is obviously like the quintessential interview question. So mine was always, so why PM&R for me was I'm the first in my family to go into medicine. And because of that, I didn't really know what I wanted to do. So after college, I took 2 gap years. There I did some EMT work and I scribed for various fields. I did some EM, I did some anesthesia, did some ortho, but what I really loved the most scribing for was for my attending in PM&R. And he became a personal mentor and a friend for me. And he really like showed me like, okay, these are the things you need to do to get into medical school. And then when I got offers, he was like, let's do mock interviews. Let's write your personal statement. Let's make sure you do everything you have to do. And it really helped me get into medical school. And then, so I already knew like, okay, I like this field. I like what my mentor did. Let me learn more about the field. I got involved in OMM research, PM&R research, and just through exploring more in that field, I was like, okay, this is definitely the field for me. I knew I always wanted to be involved in this field and pay it forward the way that my mentor did for me.
Dr. Goodwin?
So for me, I kind of had like the inverse. When I was a pre-med student, I worked as a medical assistant at a spine and sports practice. And a lot of the doctors were total jerks. And I was like, I don't want to do PM&R because of these guys. But, right before med school, my brother, who was special forces, had a really bad TBI. And the one thing the military does very well in terms of MilMed is they really integrate the family into the recovery. So I got to see firsthand, his TBI rehabilitation. And I was like, oh, yeah, these PCPs are great. And then they were like, no, these are PM&R doctors. I'm like, no way, these guys are great. The ones I used to work for are jerks. Like, what the heck? And that kind of exposed me to the spectrum of PM&R, inpatient brain injury versus outpatient spine. And then I kind of just fell in love with it there.
Then Dr. Adelman, would you be able to jump in?
Yeah, absolutely. So like what was mentioned earlier, before I even decided I wanted to go into medicine, when I was a teenager, I got a job working for a physical therapy company close by home, and spent a lot of time learning about movement, not only rehabbing my own injury, but then helping others rehab from their own injuries. It was mostly like more of an outpatient sports clinic. But it was really just a phenomenal experience, really being able to see, again, kind of that, integration between structure and function, really loving musculoskeletal medicine. So when I decided I wanted to go into medicine, I heard about PM&R, and I was like, this is exactly it. Like, this really just translates all of the skills that I've been learning in physical therapy and in strength and conditioning, and really brings it to the medical field. And so that was something I was incredibly passionate about, and continues to make me fall in love with PM&R. I love that it's got a mix of procedural aspects as well as, not only the procedural aspects, but then also being able to have that clinic time, really spending time with patients, learning about what their movement goals are. It's just really exciting.
Thank you everyone for sharing how they first got interested in PM&R. And then on that note, what are some ways that we can start getting involved within the field as a medical school, whether you're starting as a first year, a second year, or a third year? And then maybe we can start with Dr. Averill this time.
Yeah, so there's a lot of different ways to get involved. And the biggest thing you guys need to know is there isn't just one right way. There isn't one right answer into getting into PM&R. It's not, I want to do a bunch of research. It's not, I have to do all this time in the community. You pick and choose what you want to do. Good things to get started with, obviously, if your med school has a PM&R interested group, joining that and just getting to understand like what opportunities there are for your school is a great way to get started. Looking up your Special Olympics is a very good one. Adaptive sports, these are very good ways to get involved in your local community while also having a PM&R aspect to them. Also, reaching out to, like you said, your PM&R, getting involved with AOCPMR, AAPMR, Physiatry, these national organizations. They always have mentorship opportunities. They have, workshops. They have the national yearly conferences. These are great ways to get involved in the field and make connections and, learn more about what the field has to offer for you.
Thank you. Dr. Goodwin?
So at Rowan, we were lucky to have a very large pain clinic and a lot of physiatrists working at the university. And we actually do have a PM&R rotation, which a lot of universities and schools might not have. So I think, getting involved in national organizations is huge, because you get to go to workshops, you get to go to lectures, you get to really network. So like, for example, when I went to AOCPMR probably about 3 years ago, I bumped into a couple TBI doctors from Mayo who were like, "Oh, come out and do a sub-I with us." And I was like, Rochester is a little too cold for me, but thanks. So it's just a very good networking opportunity.
Dr. Edelman?
Yeah, I think totally echoing what everyone else has said already. Really, it's about finding the opportunities that stand out to you and the things that you're really excited to say, absolutely, yes, I want to spend time doing that, especially when your time is so valuable and limited. I think it's really important to find a good mentor in the space, which is, again, why a lot of these national organizations are great to be involved with, is not only do you get mentors that maybe are attendings that are where you want to be someday, but you'll get mentors that are, one step ahead of you. Maybe, if you're second year, right? Like they're a third year, or they're a fourth year, you can learn from, the experiences of others. And that's a great way of getting involved. One other thing that hasn't been mentioned is ultrasound, which is a really amazing thing to get involved with. Sometimes there's local opportunities where, or at these national conferences where you can be a model, you can volunteer to be a model for ultrasound courses, where you can basically be like a fly on the wall and learn what the attendings are learning when it comes to developing their ultrasound skills. And I found that to be an incredibly fulfilling opportunity to get involved with as a medical student. Just because, again, you get to be a fly on the wall and learn from a lot of these, really amazing people in the field. You get to know a lot of the attendings that are teaching the content, that are learning the content. And then you get to then take those skills with you and continue kind of developing that skill set if that's of interest.
And
Yeah, I think the only thing I would add is whatever you end up doing, whatever it is, help it tell your story so that when you're applying for residency, it's very clear, yes, this is why I'm interested in PM&R, and this is why I want to be a physiatrist and not EM, I don't know, whatever, like fill in the blank. So whatever it is, think, big picture, 5, 6, 7 years down the road, how does what I'm doing now tell my story in the future? And part of your application too might just be, I was experimenting, this seemed interesting when I did this rotation, I wanted to dig into it a little bit further, and I figured out that wasn't for me. So whatever you can do, you choose the things that are going to help you tell your story and who you are and what's important to you.
thank you. That's very good advice. And I think that's a good segue into this next big topic of our panel today in regards to interviews and applications, especially as fourth years go through that process right now. And so one of the biggest questions that we received was, how do you think programs weigh various factors such as these extracurriculars that you guys all mentioned, grades and research, and are there any other factors that you believe that programs really look for in their applicants? And we'll start with Dr. Goodwin this time.
So the beautiful thing about PM&R is regardless of where you apply or interview, a lot of them will definitely still give you a holistic review. You can have the best board scores in the world or the worst, and they'll still review your application on a very even playing field. The thing about it is a lot of programs have very specific missions. Some might be more like inpatient based, some might have a lot of fellowships and be very pain feeding. And obviously they want people that are going to match up with their mission and their culture. So a big thing that I would recommend is before you go into any of these interviews is kind of see what these programs are about, kind of see what they do, see what their workflow is, from PGY 1 or 2 to 4, just to kind of get a feel for it.
Dr. Adelman?
Yeah, I think this is a really big question that I'm sure is on everyone's mind. I think as a PGY1, I just went through the process, but I don't necessarily know kind of what happens behind closed doors as far as how they review applicants. So, of course, taking what I say with a grain of salt, that I'm just acting, discussing this based on my own, take on the experience. I think, really just depends on your personal journey, like what was mentioned already. They review the applicants very holistically. I think it's important to kind of think like, what am I providing to the field of PM&R, and making sure that you're kind of sharing that throughout your interviews. I think a lot of times we think, oh, what does this program mean to me? But also it's, what will you add, and what exciting things do you bring, not just skills, but also like excitement for certain areas of PM&R and things like that. And so if in your application you can highlight that, and then if you can highlight that again during your interview, I think that just, really helps you come off as a unique applicant.
Yeah, I think most places review applications holistically, meaning they look at your board scores and your personal statement and your 10 category things. And so whatever's going to help you tell that story to say, yes, this is who I am. Just to emphasize that.
Yeah, just piggybacking off the last two, your application is your story, and it's who you are. It's not something where you should be trying to portray something you're not. If you are, some people are giving you the advice, don't bring up pain. If you want to do pain, it's what you want to do. You're not going to lie and say you want to do inpatient and show up in an inpatient rehab program that only does TBI spinal cords and go, oh, actually, I want to do pain. That's not going to help anyone. It's not going to help the program get the best mentoring out of you, and you're not going to get the best education out of that. You want to be, my application said, I'm Nicholas Averill. I'm born and raised from a big Italian family. I want to stay in the tri-state area. I want to do academics, but I also like doing sports and, having a good MSK and doing procedures. And that's what I said. And, you want to, because at the end of the day, when you send your applications out and you get interviews, at that point, basically the numbers say you have a chance of ranking the match, right? At that point, as much as you're interviewing them, they're interviewing you, you're interviewing them, because you have to make sure that it's the right fit for you and your career and your aspirations for life. So the biggest thing is, again, it's holistic. It's not going to be one thing. It's not going to be like, oh, if I had one more pub, that changes everything. Or if I got one better grade in second year test, that changes everything. It's just about how you present yourself and put your best foot forward. And it's all about then just finding the right chemistry and the right match for you.
Thank you, everyone. That was very good advice on definitely trying to making sure that your application says who you are and shows whoever you're applying to who you are. And I think that's a good segue into this next question of how were you best able to assess the program culture? How are you able to know that what you are applying for is really the right fit for you, especially when you are applying, you're not really thinking too much about that versus and just seeing overall like how you felt like that particular program is a good fit for you. And then we'll start with Dr. Adelman this time.
Yeah, I think, I did a lot of OA rotations. I ended up doing 4 different programs, and I think that was really helpful context and they were different programs too, so kind of different types of programs. I think doing multiple away rotations can really help provide the context of what you're looking for in a program, which is going to be different. And every program has kind of a different feel while you're on that rotation, and you'll pick up on those differences and the ones that really are meaningful to you. Like, for example, some programs might be, a little bit more community based. Some of them might be very large programs, lots of residents, large academic institutions. Some programs might prioritize research more, some might prioritize research less. And really identifying those kinds of things and what matters most to you is really helpful. And so getting that on my away rotations allowed me to approach interviews by kind of asking and trying to figure out what programs lined up with those things that, I had then seen on away rotations, which programs kind of lined up where. And, sometimes it's about asking the important questions that you might have and finding a way, of course, to approach that question appropriately. Like I always had kind of certain questions for me where I wanted to be very proficient in certain procedures. So I would ask the residents and say, like, you're a chief resident, how are you, how confident do you feel in being able to do, XYZ procedures as an attending or after, now going into fellowship? And that was an important question for me that I wanted to know about these programs. That kind of helped me figure out certain qualities that I was looking for in programs. So I think, kind of to summarize, like knowing what you're looking for by not only seeing that on away rotations ideally, but then, really doing some self-reflection on what are your most important qualities you're looking for in a program, and finding a way to really understand those during an interview or when talking to residents.
So one of the things that was helpful for me was first dividing, do I want to be in a community program or do I want to be an academic program? So that was really helpful. And when you're looking through ERAS and all the different things, you'll get a better sense of that. So if you're early in med school right now and what we're saying doesn't make sense, that's okay. I didn't understand it until it was, application season and such. So community versus academic, and then location. So Nick said, being in the tri-state area was super important for him. For me, I didn't really care where I went, which didn't help narrow anything down. But I knew I wanted to do pediatrics. So I applied to a lot of places that had pediatrics fellowships or had some kind of lineage of people at least going to a peds rehab fellowship after. So I think that was really important. Guys, I'm about to age myself. I was the last class who had in-person residency interviews before COVID. So, to be honest, that helps with the feel, is being able to see places in person. It is cost prohibitive, especially doing away rotations. So if you can't do an away rotation, it's also not the end of the world. Plenty of people match to places where they don't do an away rotation. So they are super helpful because it does help you get a really good feel for the place. But if you don't secure one, or it's just not financially in the cards, like that is okay too. Some places, if they're doing hybrid interviews, there's often a second look day, and all of the places who I've talked to, the second look days are truly second look. The programs have their rank list submitted before the program director who even knows who's coming. So that really shouldn't have an impact on your ability to match there or not. But asking the hard question, don't be afraid to ask the hard questions. Like Jennifer was saying, how do you feel comfortable with these procedures or those things that you want to make sure that you excel in? Don't be afraid to ask the hard questions and get a really good feel for the residents. Again, in person is a lot easier than Zoom, but you just have to make do with what you can too,
Yeah, definitely, sub eyes is going to be the best experience because you're actually going to be there, right? So obviously that's optimal. Going to conferences, trying to meet people at conferences can help too, talking to residents. A lot of programs, especially in your application cycle, will have meet and greets. I highly recommend going there. Those are usually just with the residents. They'll give you a feel for how the program works, some of the good, some of the bad. They'll try and tell you really how the program goes and how their experience is. Obviously the internet also has stuff. There's Reddit. Don't always believe everything you see on the internet, guys, but there's definitely stuff out there if you want to look it up. There's also like basic stats, but in general, you can always, there's always people you can reach out to in these organizations as well that are good contacts. And again, this is it really just comes down to personal preferences, and that's something you can talk about, like even on interviews, right? Like it's okay to like I personally in my interviews, I always tried to make sure that I had time to speak freely with the chief resident or the attendings that I was interviewing with, and I asked them like, how what are things that you like about this program? What are things that you would change about the program? I had certain prompts to make it sound really nice, but like I said, you're interviewing the programs just as much as they're interviewing you. You want to make sure that the programs that you're applying to in your ranking are the ones that match your goals.
So I have a little bit of a contrarian view from what was said. So I think and this again was my opinion, like what mattered most to me was culture of a program, right? So You know, a lot of residency and a lot of medical education, you basically get what you put in, right? It's what you make of it. And, you know, if you want to do a lot of procedures, there's always opportunities you could find. There's always selectives or external rotations you could do if they don't have them in-house. But I think the one thing you can't really compromise on is the culture of the program. If it's not a good place to learn, it could be the most prestigious, sparkling, gilded place in the world. But if they're toxic, you know, it's not for you if you perceive them as toxic. But you could also have a community program that has brand new but awesome educators, great culture, and you can flourish there. So I think a lot of it really is culture. And the only way you will get exposed to that is, again, getting out there, doing some legwork, shaking hands, kissing babies, and, you know, kind of getting a feel for the vibes of the programs.
Thank you all for sharing. Those are definitely very interesting factors that we have to consider. And I know that a few of you already started touching upon audition rotations or away rotations. And one of the common questions I received was, how can a student best stand out during these audition rotations? And then if you're not able to rotate at a site that you really wanted to, given that there are limited positions, are you able to show interest in those programs even though you weren't able to do an away there? And then let's start with Dr. Wake this time.
Can you read the question again? I'm sorry.
Yeah, no worries, my bad. There was just questions about how a student can best stand out during their audition rotations,
Okay,
and then
got it.
if you aren't able to rotate there, how can you show interest in that program?
Okay, thank you. So first, standing out, honestly, it's the simple things. Show up on time, and on time means 10 minutes early. Show up looking according to the dress code, whatever that is. If you can, read about the patients the day ahead of time, read about what you're going to be seeing the next day so you can ask informed questions the next day. If the residents are doing things and they invite you, it's because they genuinely want you to come join them. Like so I did my residency at Mayo too, and we play a lot of dodgeball and kickball and all of the things. And we always invite our rotating med students. And it's like zero pressure, but like we really want you there. And so obviously that's something you're interested. If it's not, you know, that's not everybody's vibe, which is also okay. But show up, show interest, and just ask good questions. There's a lot more things I could add, but I'll let everyone else take the floor too. And then if you don't do a rotation, so if you're lucky enough to be able to go to one of the conferences, honestly, networking, showing up, saying hi. All the programs are at the booths. The program director is usually there a lot of the times. Just say hi, I'm really interested. If there are ways that you can network in advance through like research or just kind of connecting with different people, there are only so many sub-by spots. So honestly, don't be discouraged. But you know, still show up, show face best you can. Touch base with the program coordinator, say like, hey, I'm really interested. If there's a wait list, X, Y, and Z, there are ways you can still show interest. And it's a fine balance too. You know, don't send emails every week, but enough to help them put a face to a name.
Yeah, 100%. Sub-Is, you know, historically have been like the best opportunity for people to learn about programs, get a foot in for an interview and all that. The stats, you know, especially in the era of signaling, the stats don't necessarily back that up. The numbers show that signaling is the biggest factor now and getting an interview, because programs usually look for they only want to interview people that have signaled them, because usually they prefer that the most, because, you know, why waste their time on people that might not be interested in them. That's what I read in recent articles. You guys can feel free to pull up an article and say that I'm wrong. But in general, yeah, if you're on a sub-by, the most important thing obviously is just showing your passion. And, you know, that can come in different ways. It doesn't just no one's expecting you to have to know everything, you know, but, you know, being, you know, reading up on your patients and asking questions like, oh, this patient seems to have Parkinson's disease. Can you show me how to do a physical exam, going through showing like how to do showing how to exhibit tardive dyskinesia, you know, asking, oh, I read up on this. Can you further explain it to me? Just showing where it's like, or being like, hey, I'm going to being willing to present or spend extra time with your patients where it's like, oh, this patient's having a rough day. I'm going to talk to them, see how they did in therapy. If we'll go with them in therapy, like those are, because let's face it, it's tough when you're a med student, especially on sub-Is. You're really trying to impress people that don't know you. And a lot of times, like you don't, especially in PM&R, you don't have that much responsibility. In other fields, internal medicine, they might let you go see a bunch of patients or write notes. PM&R, a lot of time, it's more just going, seeing your patients, and playing a role in the care. So maximizing your ability to show that you care and ask questions should make a good look. But in reality, if you can't do sub-Is, signaling programs you really want to be at, it's going to be a big role. Reaching out to, residents, seeing how you can get involved. Like it's easy in Philly, there's like 5 programs, but like there's always different runs, like the Rocky Run, the Philly Marathon, different programs have monthly ultrasound clinics, things like that where you can get involved. But then like more community-based or places closer to you, always feel free to reach out to their program coordinator. The worst thing they could say is, sorry, we don't have any opportunities right now. No one's going to be like, oh, this person's annoying, blacklist them from everything going forward. So, just be bold.
Dr. Goodman?
So I've had the unique privilege, both of being a chief my intern year and also, just where I am at Hopkins, dealing a lot with sub-I students. So from my perspective, I never actually did a sub-I at Hopkins. I applied for it. They said, sorry, we're full, better look next time. So, it's not the be all end all if you don't get a sub-I. However, at the sub-Is you do have, you want to be a rock star, right? So I'll split it between like what I did intern year and what I'm doing now and what I see. Intern year, as a chief resident, which is super weird, I had to do evals on med students all the time, basically like monitor, are they on time? Do they care about learning? Do they show up? Do they represent themselves well? And the thing with that, like for at least like TY prelim years, if you do sub-Is for those of you trying to get in, they want to see thought, right? They want to see you actually put 2 and 2 together, not just show up with a cup of coffee 20 minutes late to rounds, which I've had many times before with students. But from the PM&R perspective, if your sub-I doesn't have it built in and there's a lot of downtime, go and watch therapy. Like PM&R is a team sport, and we have a lot of a lot of our decisions are influenced by the therapy team. You go introduce yourself, be very kind, get them to like you. We actually, one of our sub-Is did just get an invite to interview because the rehab coordinators were like, that kid's incredible, he's so nice, he actually cares, like we want to see him here as a resident. So a lot of that stuff does trickle down. If you can, try to write notes during sub-I practice, because no one will really, some people will go into intern year and never having written a note before. Helping the residents with their workflow, they definitely appreciate it, they love it. And asking a lot of questions, just don't be there on your phone. I had one kid who was watching the Mets game on his phone one day, and I was like, bro, you flew 4 hours to be here for 4 weeks, like come on. So just go above and beyond, and you'll really shine. It's the little things.
And Dr. Adelman?
Yeah, I'm just going to echo kind of a lot that was already said. I think doing the simple things right, like showing up on time, super important. I think one thing that was kind of mentioned in many different ways, but I'll just kind of summarize, like just show that you're engaged with the patient care as much as you can, like get as involved as you can, whether that's going to therapies, whether that's writing notes, really. I had some aware rotations where like the resident would say, hey, why don't you if let's say I only pre-charted for certain patients, and I didn't actually pre-round, because that was kind of the norm at some of the sites I was at, that, they would say, hey, when we go round with the attending, like, why don't you lead the patient interaction? And so that was, again, just another way of really getting involved with the patient care, and as involved as you can get, the better. I think the expectations for what are relatively low in PM&R. They're not expecting you to come in and know everything, which is great. Of course, studying up on things, having like a Pocketpedia in your pocket. If you've heard of it, it's a little blue book that's all about, kind of the basics of PM&R, goes into, quite a bit of detail on some of the most common pathologies that we are working with and managing. So, having some of those resources, going through some of those at a very basic level so that you have a little bit of understanding before you go see a patient with a certain pathology is great. I would always have my Pocketpedia out. If there was downtime, I'd be reading through, trying to see if there was something I could add for a patient. So that's great. But I think asking really good questions is going to be really important too, because again, they don't expect you to know it all. But if you can demonstrate that you're doing the best you can to learn and to follow along on a patient case, even though you don't know everything, is really one of the best things that you could do.
I'm going to add one more thing, sorry. Asking for feedback and actually acting on said feedback is a way to impress people for sure.
So thank you everyone for those very, very helpful tips. I'll definitely use those as I go on my rotations next year. And then given the time, the last prepared question that I wanted to ask you all was if you could share a little bit about what you liked best about your respective programs, and then we'll open the floor to any questions from the audience after. And we'll start with Dr. Averill.
Yeah, so things that I loved about Temple were one, a lot of my mentors went there. At Rowan, I really loved Dr. Sue, Dr. Bailey. They were both Temple trained. And the people that trained them were the people that were still running Temple. And then I got to do a sub by there, and I got to work with Dr. Young, Dr. Wu, Dr. Habibi, Dr. Mayton. These were all doctors I really liked. And I also liked that I was close to home. I really liked the residents. I became close friends with two of the residents. One of them is now our chief resident. And it just fit culturally what I wanted: academic, historical program of PM&R. The fact that I knew people in the program, mentors and residents, it just seemed like a slam dunk, and it made sense for the next step in my career.
Dr. Goodwin?
So what I really love about Hopkins, it's kind of like a build your own adventure after PGY2 year. You do your 9 months of inpatient, and then after that, it's mainly elective. Like, you want to go into spine, TBI, whatever, peds. The PD does the schedule, not the chiefs, and the PD will make sure she sets it up that you get what you want. The culture, incredible. It's funny. When I first came down to Baltimore, I was drinking a lot of caffeine. I was like still in that ICU mindset. I'm like, I gotta sleep 3 hours and work 20 straight. And my PD comes in like the first week because she was rounding with me, and she looks at me and goes, "Did you sleep like 5 hours last night?" I'm like, "Yeah." She goes, "Go take a 2 hour nap right now. ACGME guidelines say you have to." And I was like, "I get to take naps here? This is great." So, it's about having like that good culture, a PD that really cares about you and, lets you kind of take off and be independent.
Dr. Adelman?
Yeah, I'm really excited to be going to Stanford. Again, I haven't started there yet. I'm still in my transitional year program, but some of the things that I loved about Stanford was when I did there, I really found that a lot of the residents not only had a great culture there, everyone was excited to come to work and really just very fulfilled with what they do. I also found that a lot of the residents had a lot of confidence in their procedural skills. and not just procedural skills, but their ability to manage patients on an inpatient unit as well. It was something that I had seen that it really stood out that they didn't feel like they needed to go to fellowship in order to be a strong attending. They really felt so confident in their skills that they were like, no fellowship needed, I'm ready to go. And so that was just really
I think we may have just lost her. Oh, no, she's back.
Hi, sorry, my connection cut out for a moment. But I guess the point is just I felt like there was a lot of confidence in the training that the Stanford residents got, and I saw that reflected in their in what care they were able to provide. And so I wanted to get strong training like that to be able to provide the same care.
So I wanted to go to Mayo for residency and stay for a fellowship because, again, the culture. So the overarching objective at Mayo is the needs of the patient come first. So everything really revolves around that, and having really strong education practice, clinical practice, and research, and having a lot of the supports in those three, we call them the shields here. But really it's like also the pillars of academic medicine too. And so having really strong supports in each of those areas, and no matter what you want to do, if you wanted to go straight into practice or any kind of fellowship, that was an option. The people are also just super fun. Like I said, we play dodgeball and kickball and volleyball and do all the things. And I really love Rochester as a town. It does get cold, but we also saw the Northern Lights last night and the night before that. So it's pretty cool. But I like more of that kind of small town feel, and Minneapolis is super close. So, proximity to a major airport is really nice, but everything was just the right fit, and everyone is just really phenomenal here and really kind. Midwest nice is a real thing. And so I really love being here and was really happy to stay here for fellowship too.
Thank you, everyone. All your programs sound really lovely. I hope I find that experience as well. And so now I'm going to open the floor to our audience. If you have please feel free to unmute if you're comfortable with that, or drop it in the chat, and then I can address that as well. And on that note, I do see that there is a question now. I was wondering if you guys could talk about what you guys did specifically to get into your specific programs and what you guys did to be outstanding candidates. Okay, so maybe we can start with Dr. Goodwin.
So, kind of in the same vein that each program has things that they care about for their mission. Hopkins is very academic centered, very research centric. And those people who know me know I'm a huge research nerd. Probably doing at least 8 to 10 projects a week. So that, then getting involved in some of the resident research back when I was still a youngin', just kind of getting your hands dirty with the program and showing them that you're someone that can align with their mission and kind of carry that torch if and when you go there.
Dr. Adelman? I think she might be still driving.
Sorry, can you hear me a little bit better now?
Yes.
Okay. It kind of comes back to finding your passion project. And for me, it was really diving deep into ultrasound education, really trying to learn as much as I could about ultrasound. I also started like a sports medicine recovery booth, and that allowed me to kind of bring OMM to the sidelines, where we would go to like 5Ks and 10Ks. And that was a really cool experience. Can you still hear me?
Yes, we can hear you.
Okay, perfect. So I think like really finding your passion project and leaning into it, and trying to get involved with something that you're really excited about, I think is super important. And then, again, like I think you don't have to do the away rotations, but I do think it helps so that like you do have a face to the name. And I think I think that really helped with Stanford. I did a couple of rotations there. One is a third year and one is a fourth year. So that time really getting to know the residents and spending time with the group, and seeing the attendings at conferences and saying hi and catching up and that kind of stuff, really, I do think it makes a difference. But of course, like, you could still find a way to do that without doing an away rotation, but I think that helped.
So I was chief, and reading through all the applications, I was just so impressed by everybody. I was like, I don't think I would get into my own residency program even now. But to be honest, like, if you're going to do research, make sure it's quality research, having connections, just kind of reiterating all the things that we've already talked about. And honestly, it sounds really cheesy, but be yourself.
Yeah, so what I did a lot was I wanted to give myself the most well-rounded application possible. I knew I wanted to play into certain strengths. I wanted to play into the type of person I was and the quality of the character I was. So I did a lot of I did a lot of leadership stuff. I got involved in organizations. I started a research team regarding OMM at my school. And then I collabed with Brandon and we started FFRI together, which is our nonprofit, which we help kids get research and help teach them professionally how to do proper research and all that. And we did that because, there wasn't openings for us. Like when we went to Rowan was like, oh, we get state funding for research, yada, yada, yada. But it's all tied up to their PhD programs, which most universities do. So, we started doing a lot of research, and we were very fortunate that Dr. German, Dr. King, Dr. Bailey, Dr. Sue were such passionate PM&R mentors in regards to willing to PI anything we come up to, as long as it was quality. And we were able to pump out a lot of research, and that's why we were able to do a lot of good things and really stand out on our resumes. And, and then as for Y Temple, like, I really went to the sub-I, and it was my second or third sub-I, and it was the first one where it was like, for me, that I felt at home with. I felt comfortable. I didn't feel like I was being, watched with a hawk eye waiting for someone to mess up. They're like, oh, Nick, go into the room and go see the patient. Tell her to get back. I was like, you're not gonna go in there and point out when I do a physical exam part wrong? They're like, no, like, go in there, get all the information you can, and then we'll come back in and we'll see the patient together. And I was like, oh, okay. So, because I liked having that freedom, and that was something I really evaluated. So again, it's all based off the story you want to tell and what you personally value.
Thank you. So the next question we had in our chat was, how do you ask an attending to be your mentor? And Akinchita, who is our AOCPMR Medical Student Council president, she very kindly dropped a link in the chat saying that AOCPMR has a free mentorship program that you can sign up for if you are looking for a faculty mentor. But if one of our panelists has like a really strong recommendation for this question, please feel free to jump in. Okay.
Oh,
I was just typing a response, but I'll just say it. So I think mentorship comes in many different forms, and sometimes it will just be for a project. Sometimes it will be to get into residency. Sometimes it will be naturally just kind of become lifelong. So letting people know in advance too, specifically what you're looking for, so they also have an idea of what kind of time commitment it's going to be. How often do you want to meet? Are we trying to just publish this research project? Are we trying to get to this conference, X, Y, or Z? And just being really straightforward of what that is. Some mentorships are going to be really formal, where you have kind of assigned meeting times. Some are going to be more peer mentors. And then some are just going to be like, I have a lot of informal mentors too, where I just text or call them and say, what do I do in this type of situation? But to ask a mentor, I think it's an attending, if you already have some kind of relationship with them, and then just being frank, and even just setting up a meeting time to say, hey, I want to talk to you about this and what this might look like, and what kind of bandwidth do you have? Because then if you ask them what kind of bandwidth do they have too, then that also kind of gives them the ability to say no. and not because they don't like you as a human being, but because they want to give you strong mentorship. And they might be able to help point you in the right direction for who might be able to help you with that thing that you're looking for.
Awesome. Sounds great. And so I know we have a lot of questions, so I'm going to try to get through all of them. So maybe for these next few, we'll have just one of you answer, just so that we can kind of address everything. The next question that I see is, do you have any tips on getting sub-Is? Do you recommend cold emailing or calling? How much networking is needed to secure these sub-Is? And anyone can jump in.
Yeah, I think basically, you know, follow the instructions for what they provide for getting the sub-Is. Usually, like the classic advice is like apply the day that it opens, which I do think you should try if you can to follow that. Again, I'm not in these rooms that are making these decisions, but I have heard that, you know, applying on the day that it opens is incredibly helpful. As well as, you know, if you send an email, if you're really interested in that program and genuinely saying, hey, I'm interested in your program, and here are some reasons why, and like emailing the coordinator, or if there's like a medical student coordinator or something, you can email them, but you don't necessarily need to include the program director, but at least saying, you know, to the coordinator, hey, I'm interested. I've also heard that makes a difference as well. But again, just showing genuine interest. And like if I saw a program director at a conference I was at, I would always say, hi, I'm interested in a rotation. I already submitted my application. Like, thank you so much for considering. Things like that. You know, again, I kind of did them in the sense that it's like, well, if it helps me sleep better at night, knowing that I did it and I gave it my best shot, and if it doesn't work, that's okay. That was kind of my approach.
Awesome. Thank you for sharing. The next question is, would you be willing to share what factors you considered most important when making your residency rank list? Mm, yes. This is the closest one who just did this. Dr. Adelman, would you be willing to answer this question?
Sorry, can you repeat the question?
Yes. Would you be willing to share what factors you considered most important when making your residency rank list?
Yeah, so my personal preferences, location was important to me. I'm from California. I've always been in California. I definitely had programs that were high on my rank list that were not in California, but that was kind of an important factor. So I think it's important to be honest with yourself when it comes to, you know, if you have a location preference, like know that, and it's okay. So location was important to me. Again, kind of going back to like procedural experiences, that was really important. Um, Came down to culture again, like we've alluded to this multiple times, but like, you know, really did I feel like I fit in with the residents there? And like I ranked a program pretty highly that I didn't rotate at, but I just got really good vibes from the interview. And so I knew that I would probably fit in really well there. Those were really some of the important things. Yeah, I think it's important to be honest with yourself about the location thing, if that's important to you.
And then along that same vein, there's another question where they said that I know the main advice is to rank programs in the order I actually prefer, but do you think it's worth considering how competitive or geographically selective a program is, like ranking one higher if I feel that I have I have a better shot there? And then,
So I could go into this like pretty in depth. But to simplify it, the rank list is applicant first. So truly rank your preferences in order when it comes to like the match rank list. Basically the math, like the way it works is like it's going to put your preference first and then it's going to see if it works. So like always follow your own preferences. Don't let yourself get spooked by competitiveness of a program because you know it might still work out for you, so always put your preferences first.
Just to piggyback, preferences first. But if you are interested in like different things about the match, the Sheriff of Sodium, he has a YouTube channel, not to plug him. I don't know this person, but he breaks down like all the stats of the match. He breaks down the game theory stuff about the match if you wanted to learn more about that stuff. But ultimately, yes, it's more about what you value and placing that first. Because, it doesn't matter if you match at a program and it's not what you want. Like, you're not going to be happy, and you're not going to, it's if, oh, I matched at this program, but it's not what I wanted, you're going to be a miserable resident, and you're not going to maximize your experience. As much as, like, remember, these are our formative years. We're trying to become the attendings we always dreamed of becoming. So be it a program that's going to help you become that attending.
Okay. The next question is, how did you decide which niche in physiatry resonated with you the most, considering how wide-ranging the field is?
So this is something I'm very passionate about. I think finding your niche in PM&R is stepwise, right? Because we can't lose the forest in sight of the trees first and foremost, right? So before you go into PM&R, you have to make sure you're very solid in medicine during your intern year. Then once you're in PM&R, you got to make sure you get a very solid PM&R foundation. And then once that's done, then you kind of could wander and fall in love with things. But I think you got to make sure you don't lose the forest inside of the trees off the rip. Um, and the beautiful thing about a lot of programs and the field specifically is you will have a lot of elective time. So, a lot of people will come in and they say, like, oh, I really want TBI. And then maybe they do an SCI rotation, they fall in love with that. Don't come in with blinders and only want one thing. Keep an open mind and you'll find your niche accordingly.
Awesome. Thank you for sharing. And the last question that I received in the last 2 minutes we have is, does your research have to be directly within PM&R? What if you have done a lot of research in a different specialty before medical school, but are interested in PM&R?
So the analogy I like to use for it is like money, right? So if you need X amount of dollars to buy the spot you want, if it's in a different field than PM&R, it's still a currency, it's still valuable, but it might be in euros, for example. So it will translate over, but it might not be as strong. So obviously, the more research you have in a specific field, the better. But if you do have some, it's better than none.
Awesome. Thank you so much. And I
I
think,
would just say to make sure whatever you're working on like translates to whatever you want to do in rehab too, or be able to explain how it might transfer, like how those skills themselves are transferable, and be able to explain what the research was that you did, because there's nothing worse than trying to answer a question about research you did 5 years ago and you have no idea.
okay. So I think that's all the time that we have for all the questions today. I want to do a huge thank you to our 4 panelists for being here and taking the time out of their busy days to come speak with us. And I think they all dropped their contact information in the chat. I'll also send an email out with that information in case you didn't have the time to copy those down. But thank you to everyone who showed up today. I really appreciate you all showing up, and I hope that this session was helpful for all of you. Definitely was helpful for me. And with that, I hope you all have a great rest of your nights.